We can discuss this now with Dr. Bharat Pankania joining us from Bath in the UK. He's an independent expert on infectious disease management. Doctor, it's always good to speak to you. Thanks for joining us. So when it comes to the situation in Nigeria, why has the case fatality ratio worsened this year compared to 2025?
So this is a clear example of poverty, war, and not enough healthcare facilities. So meningitis infections can be rapidly fatal. So when you present late, of course, your case fatality goes up. Similarly, if you have a shortage of antibiotics, then your case fatality again goes up. And finally, if you have poor tools in which to diagnose the illness as soon as possible, again, that late intervention results in a poor outcome. So overall, my answer to you is this is all an example of poverty, war, and insufficient healthcare services.
So given all of those factors that you've laid out, in 2022, the Nigerian government set up a committee to ensure local vaccine production. Does all of that now factor into why local vaccine production just simply hasn't happened, which in this situation could really help those infected?
Indeed. So it is happening, but it hasn't happened as well as we would like it to. So the CDC Africa, CDC Nigeria, as well as Gavi are setting up programs for the manufacture of vaccines locally. Unfortunately, that scaling up of making millions of doses locally has yet to happen. But otherwise, there is good cooperation, there's good work happening, but more has to be done.
The African meningitis belt covers such a vast area. Why is meningitis so prevalent in sub-Saharan Africa?
So this is again an example of poverty and the environment and climate change. So when you have extreme heat, a lot of dust, that dust disrupts your mucous membrane, the lining of your nose and your throat, from which the bacteria in a crowded environment can pass from person to person in a poorly ventilated, crowded refugee camp or crowded housing accommodation, and then it spreads from person to person. And this has been something that I know of over many decades, and I always shake my head and say, here is an example of poverty which results in the deaths of many people.
Why is not more being done then? Does it come down to the fact that, especially right now, we're in the middle of so many crises with wars playing out? And also we saw just last year the US stop US aid for so many parts of the world, Africa in particular being highly affected by that.
Indeed, and I agree with you, and I have grave concerns about US aid being removed from certain countries. And there, unfortunately, and very tragically, we will see a rise in the number of HIV AIDS cases as well. So, of course, more can be done because the world is one village, and the West and other rich nations owe it to Africa to make sure that they have programs like meningitis prevention, which is eminently preventable with vaccines. So provided you have a good supply of logistics and vaccines, a lot of this is preventable.
It's terrible to think that in 2026, preventable diseases are still killing so many people. Dr. Bharat Pankania, it's always great to have you on the program and break things down for us. Thank you very much.
You're very welcome. Thank you.